Hi, I'm Dr. Lynn Wagner, and welcome to Doc's Thoughts. So I'm going to share a story today about a patient I saw recently in urgent care. He was about 40 years old, he had hip pain, and he was a carpenter. So he'd been having hip pain for about 3 months, had tried the chiropractor, tried ibuprofen and Tylenol, and just wasn't getting any better. So he came into the urgent care to see what else he could do. He doesn't go to the doctor that often. And so I did all the normal stuff. We x-rayed his hip, and I ultimately referred him to orthopedics so that they could do more management to help with his pain and figure out what was going on. He probably needs an MRI. But the whole point of the story was I looked at this guy's chart, and he had the diagnosis of erectile dysfunction, obstructive sleep apnea, and obesity. And it made me think, so here's this guy who's coming in, he's having hip pain. I know as a more of like a wellness physician that probably the cause of his hip pain is his excess weight, so it's wearing down his joint cartilage and causing arthritis, which is probably lending to the hip pain and lack of flexibility, all that stuff. And then I also know that he has all these diagnoses. So I kind of peeked at his chart a little bit more, and I realized, the guy goes to the doctor once a year, he gets his prescriptions refilled, and then he goes back to his life and continues on. And what I see with that is a trajectory. I see a trajectory of increasing disease burden, increasing suffering, and decreased joy in his life. And it made me think about how we go about things in the Western medical system versus how we should go about things in the way the healthcare system should be. So the reality is there's always more disease beneath the diagnosis, right? So this guy comes in with hip pain. That's his diagnosis for the day. Underneath, though, he has disease burden that is contributing to that day's diagnosis. And in Western medicine, we treat the diagnosis with pills and procedures, but what we don't do is we don't look at why is that diagnosis coming about. So if you think about this guy, a better way of going about things would be this. Okay, you have erectile dysfunction. Sir, I know that this means that you might have calcifications or problems with your arteries, which is why you don't have good blood flow to your penis. And this may mean that you also have decreased blood flow to your brain and your heart, and we should look at that. We should do a calcium score. We should look at your lipid panel. We should look at your inflammation markers. We should look at all that stuff and then present it to you so that you can make different lifestyle choices and maybe even take medications if you need them to decrease your risk for future disease burden, okay? So that's one example. Another example would be, okay, sir, you have obstructive sleep apnea and obesity. I know that obstructive sleep apnea is usually caused by obesity, and we also know that obesity in itself is an inflammatory disease state, which is going to cause other diseases. So might we actually look at that and say, how can we not make you obese? Do we need to put you on a weight loss drug? Do we need to talk to you about your lifestyle and your diet? Do we need to do all those other tests that I talked about to look at your markers of inflammation and your lipids and your calcium score and all those things, so we can then present to you a picture of what your health is right now, and if you continue down the same trajectory, what your health will look like 10 years from now and 20 years from now, and give you an alternative. Because that alternative is when we fight disease, we decrease inflammation, we give you better quality of life, and we just give you more joy. So that's the whole point is, if you or a loved one are carrying diagnoses, and you go to the doctor and you get diagnosed with something, you get put on a pill, look at it a little bit differently. Spin it around a little bit and ask yourself, is there something that is causing this diagnosis, and can I do something about it? And is there a doctor like Dr. Wagner who I should go see who can look a little bit deeper? And with that being said, ask me any questions you want, and we'd love to see you soon.